Ethan is worried because his son Van isn't like other kids. Van doesn't understand many things and can't really talk very well. He's 14, but he seems to have the same intellectual capacity of a 7 or 8-year-old. Van might be suffering from an intellectual disability, which used to be called mental retardation. This is a psychological developmental disorder that is marked by a very low IQ and problems with everyday functioning, like communication or taking care of oneself. It is almost always diagnosed before age 18. Imagine that you are a psychologist, and Ethan brings Van to see you. Van is a nice, well-behaved young man, and he seems to be relatively happy. So why does he need to see a psychologist? Because intellectual disabilities fall under the category of lifespan development disorders, they are covered by the field of psychology. Remember that one of the criteria of intellectual disabilities is a low IQ. IQ is a measure of intellectual ability based on an intelligence test that is administered by a psychologist. Another reason why Ethan has brought Van to see you. The first step in diagnosing Van is to give him an intelligence test. The average IQ is 100, and to have some sort of intellectual disability, Van must score below 70. When you test him, he scores a 59, so he has an intellectual disability. But there are different levels of disability, so now you must figure out which one Van has. Mild intellectual disability involves having an IQ between 50 and 69. Usually, people with mild intellectual disabilities take longer to speak and understand, but they can communicate. They can often also take care of themselves. Moderate intellectual disability is diagnosed in patients with an IQ between 35 and 49. These patients usually have trouble communicating and can do some things on their own, but are probably not self-sufficient enough to live alone even as an adult. People with severe intellectual disability have an IQ between 20 and 34. They often have motor difficulties as well as problems communicating, learning, and taking care of themselves. Finally, profound intellectual disability involves having an IQ under 20. People with profound intellectual disabilities are often immobile and cannot take care of themselves. They are not able to communicate. Based on the criteria above, you can diagnose Van with mild intellectual disability. Ethan is concerned that perhaps it's his fault that Van has an intellectual disability. He's a busy single father and thinks that maybe he didn't read to Van enough when he was a child, or perhaps he didn't give him enough attention. You can reassure Ethan that neither of those things can cause intellectual disabilities. Sometimes there's no way to know why a person has an intellectual disability, but there are some causes that we know about. Number 1. Genetics. There are some genes and genetic mutations that can cause intellectual disabilities, such as Down syndrome or Fragile X syndrome. Number 2. Trauma before or during birth. Not having enough oxygen, exposure to high levels of alcohol, or infections in vitro can all cause intellectual disability. Number 3. Lead or mercury poisoning. This is especially common for babies and toddlers who ingest lead-based paint in old buildings. Number 4. Severe malnutrition. A lack of proper nutrition in infancy and early childhood can slow or prevent brain development, which can lead to intellectual disabilities. Number 5. Illness in early childhood. Some sicknesses like whooping cough, measles, or meningitis can cause intellectual disabilities if a child gets them early enough in life and has a severe enough case to cause brain development problems. There is no cure for intellectual disabilities, though there are some treatment plans that can help people learn to live their lives in a more productive manner. Therapy can help a person with an intellectual disability cope with their disability and learn to function in society. While they are in school, patients with intellectual disabilities are given an individualized educational program, or IEP for short, which outlines how the school will help them learn and develop. Finally, the family and caregivers of people with intellectual disabilities will also need to work with professionals to develop and follow a care plan for the patient. This will outline what the child needs and how they will receive it. Parents and caregivers often also need therapy to help them deal with the emotions involved in taking care of a child with an intellectual disability. An intellectual disability, which used to be called mental retardation, is a psychological term for people with a very low IQ and problems with daily functioning. There are 4 levels of intellectual disability: mild, moderate, severe, and profound. There are many causes of intellectual disabilities, including genetics, trauma before or during birth, lead or mercury poisoning, severe malnutrition, and illness in early childhood. Treatment includes therapy for both the patient and his or her family and caregivers.